Ear ringing is not a disease itself, but rather a symptom caused by various conditions such as age-related hearing loss, hearing damage, circulatory system issues, or side effects of certain medications. Ear ringing can also be a natural phenomenon. Furthermore, it can also serve as a significant warning sign of an abnormal condition within the human body. Ear ringing typically occurs when a noise like rushing wind, whistling, or buzzing inside the ear affects one or both of your ears. This specific issue can persist continuously, or the ringing may occur at many different times throughout the day. Hello and welcome to the Dr. Koob YouTube channel. I am Mohammed Zari, an instructor in internal medicine and surgery. People who experience persistent ear ringing usually notice it much more at night or during quiet moments of the day. This ear ringing may often be accompanied by significant hearing loss, frequent dizziness, or headaches. This is a complex problem that occurs within the ear's intricate sound processing system and can be related to a variety of different underlying diseases. Most people who suffer from chronic ear ringing also tend to have noticeable hearing problems. There are generally two distinct types of ear ringing to consider. The first specific type is known as objective or external ear ringing. This specific and unusual form of ear ringing can be heard not only by the patient themselves, but also by the examining doctor or other people nearby. This type of ringing is rare and is usually caused by vascular or nerve disorders, tumors located in the head, neck, or brain, or structural defects in some of the ear's components. The second type is subjective or internal ear ringing. In this specific type, only the patient themselves perceives the sound. This variety accounts for 95% of all ear ringing cases. In more than 60% of these specific instances, the underlying cause cannot be found, even if various complex tests are performed. What is the main cause of ear ringing? The most common cause is significant damage caused by excessive noise exposure, which is frequently seen with listening to extremely loud music or from being constantly exposed to loud sounds, leading to persistent ear ringing. Furthermore, people over 60 years old are at a much higher risk of ear ringing due to the natural process of aging, which often results in gradual hearing damage. Specific medications are toxic to the ear and can damage the sensitive auditory cells, such as aspirin, streptomycin, gentamicin, or quinine. Additionally, certain injuries to the head, face, or neck can also cause persistent ear ringing. A cold can cause swelling of the nasal mucous membrane and coughing, and it can also lead to ear ringing. A concussion or a sudden forceful physical impact to the ear can also cause ringing in the ears. Flying at high altitudes, experiencing severe and sudden blood loss, and certain serious illnesses such as diabetes, atherosclerosis, high blood pressure, or various types of cancers like nasopharyngeal cancer, jaw cancers, and brain tumors are additional potential underlying factors of ear ringing. Furthermore, the frequent use of various stimulants such as the consumption of alcoholic beverages, caffeine-rich coffee, and nicotine from cigarettes can also cause persistent ear ringing. In addition to the physical damage associated with hearing loss, the sensation of ear ringing can also result from general bodily dysfunctions, such as dental problems and muscle tension in the neck. What are the symptoms of ear ringing? People with persistent ear ringing often hear a distinct sound in their ears, even when no external sounds are actually present. Because they have the condition known as tinnitus, they often think that it is outside noises echoing inside their ears. The most common symptoms of tinnitus are various sounds that exist in the ear, such as constant buzzing, whistling, background noise, or sharp hissing sounds. The perceived auditory sensation can be intense or faint, high-pitched or low-pitched, and it can occur in one or both of your ears. In some cases, the tinnitus sound is extremely loud, and at times the patient cannot hear the actual sounds present in the surrounding external environment. If there is an excessive amount of hair growth within the ear canal, it can potentially cause significant harm to the patient. You won't be able to hear real sounds from outside the ear, and instead you will always hear a loud, persistent sound inside your own ear. Elderly individuals or patients suffering from certain diseases that I explained earlier are at a substantially higher risk of developing persistent tinnitus. Additionally, people who frequently consume stimulants can also develop tinnitus over time. When should we consult a medical professional? Most of the time, tinnitus does not cause any significant physical harm to the individual, but it can potentially result in discomfort, anxiety, preoccupation, insomnia, and depression. In various other instances that are accompanied by symptoms such as dizziness, underlying ear-related conditions, hearing loss, or a persistent headache, these signs must never be overlooked or dismissed and should be diagnosed and treated as promptly as possible. Especially when tinnitus is accompanied by a sudden loss of hearing, you should seek professional medical attention without any delay. Evaluation and effective treatment must be carried out very quickly. If delayed, it can lead to permanent and irreversible hearing loss. In addition, if you have long-term tinnitus, you should be under the supervision of a qualified ear, nose, and throat specialist. Let's move on to several herbal and quick remedies for the immediate treatment and relief of tinnitus. The first remedy is chewing gum. Chewing gum is one of the natural treatments for ear, nose, and throat issues that can be done at home or anywhere else. When you chew gum, you help the vestibular muscles in the ear, which can effectively eliminate tinnitus. In addition, while you are chewing, more saliva is produced by the glands in your mouth, which can be quite effective in treating certain types of tinnitus. This very simple method has no side effects at all, and it is something that all of you can easily do. The second remedy is treating tinnitus with apple cider vinegar. To use this simple method, mix 1 teaspoon of apple cider vinegar with 1 teaspoon of raw honey and a full cup of warm water. To achieve even better results, you can also consider adding a little bit of freshly grated ginger to the blend. It is best to consume this mixture while it is still warm, and you should repeat this treatment 3 times throughout the day. The third method is using the medicinal plant ginkgo biloba to relieve tinnitus. Ginkgo biloba is known to be very effective for treating persistent tinnitus. You can easily get the herbal extract of this plant from your local pharmacy. The recommended dosage is 120 to 240 milligrams, which is enough to take once a day for treating tinnitus. It is very important to keep in mind that you should not use this medicine for young children. If you are ill and need medication, make sure to consult with your doctor about combining your medicines with this plant for greater safety. The fourth remedy we recommend is garlic. You should try to use garlic as a spice regularly. Incorporating fresh garlic cloves into your daily meals not only helps to enhance the flavor profile of your food, but it also helps provide relief for tinnitus. The fifth remedy is treating tinnitus with ginger. You should incorporate fresh ginger into your daily meals and let its natural aroma infuse your dishes to help prevent or treat tinnitus. In addition, you can also chew on several small pieces of raw ginger throughout the day. This simple habit helps reduce the internal pressure in the ear and leads to a significant reduction in the ringing of tinnitus. Moreover, you can still use ginger in other beneficial ways that I will mention shortly. Place some fresh ginger in a glass of warm water, and after letting it steep for about 10 minutes, stir in a little honey to it. Drink this soothing herbal tea 2 to 3 times each day. Regularly using this method will help you achieve your desired results quite quickly. The sixth method is treating tinnitus with pumpkin. Using fresh pumpkin is highly effective for preventing or treating the symptoms of tinnitus. You simply need to regularly include pumpkin in your daily meals, such as in healthy salads or warm soups. After a period of consistent use of this natural method, you will surely see some unexpected results. That is why using pumpkin is considered one of the very best natural home remedies for tinnitus relief. The seventh item is pineapple. Using pineapple is an incredibly effective natural method for treating tinnitus. What you need to do is incorporate fresh pineapple into your daily diet or regularly drink pure pineapple juice. After a short period of consistently using this remedy, your tinnitus symptoms will show a very significant and noticeable improvement and may even disappear entirely. This is one of the most effective home remedies for tinnitus. And the eighth item is yawning, which is highly recommended for alleviating the symptoms of tinnitus. Thank you for watching this video until the very end. If you have questions, leave a comment and I will respond. Goodbye.